Effects of 2 instrument generation changes on adenoma detection rate during screening colonoscopy results from a prospective randomized comparative study. Introduction. Colonoscopy quality is crucial to achieve the desired outcomes of the examination, namely to reduce the occurrence of colorectal cancer by finding early-stage cancers as well as colorectal adenomas as precursor lesions. These goals are especially relevant in the screening setting. The main quality parameter to measure outcome is therefore believed to be the so-called adenoma detection rate, ADR. This assumption is based on studies that have correlated interval cancer rates with the ADRs of the colonoscopists. Measures to increase ADR have therefore been the focus of numerous studies dealing with improved endoscope imaging features. However, improvements of only one of these instrument features, such as widening of the angle of view, using high-definition television, HDTV, imaging, or image post-processing, e.g. narrowband imaging, NBI, Fujinon Intelligent Chromoendoscopy, FICE, or iScan, have not led to a consistent ADR increase. Several meta-analyses have summarized this lack of effect on ADR of HDTV and image enhancement techniques, the most recent. However, conflicting results were recently reported on widening of the endoscopic angle of view. Therefore, it could be speculated that it may take several imaging changes, such as those associated with technical progress developed over 2 colonoscope generations, i.e. comparing the latest instrument generation with the next to last one, before improvements in ADR can be measured. This hypothesis was based on 2 previous retrospective studies from our group and was recently confirmed for diagnostic colonoscopy in a prospective randomized diagnostic tandem study in a hospital setting. We have now tested this hypothesis in a different setting, namely a private practice screening colonoscopy setting, with a group with whom we have previously performed several larger randomized colonoscopy trials. Background. Previous studies have shown that multiple colonoscope features have to be changed before an improvement in adenoma detection rate, ADR, becomes obvious, such as with changing from one instrument generation to the next but one. We wanted to evaluate whether such an effect can also be observed in a private practice screening setting. Methods. In a randomized study, we compared the latest generation colonoscopes from one company, Olympus X03 190, with the next to last one, Olympus 165, including only patients presenting for screening colonoscopy. The primary outcome was ADR achieved with 190 colonoscopes, 190C, in comparison with 165 colonoscopes, 165C. Results. 1,221 patients, 46.1% men, mean age 62.2 years, standard deviation 6.6, were included. 599 screened with the Olympus X03 190. The ADR difference in favor of the 190C instrument, 32%, 95% confidence interval, CI, 26% to 39%, versus 28%, 95% CI, 22% to 34%, in the 165C group, failed to reach statistical significance, p equals 0.10. Only the rate of small, less than 5 mm adenomas was significantly increased at 22.5%, 95% CI, 19% to 26%, versus 15.6%, 95% CI, 13% to 18%, p equals 0.002. Furthermore, significantly more adenomas were found in the 190C group, with an adenoma rate, all adenomas, all patients, of 0.57, 95% CI 0.53 to 0.61, versus 0.47, 95% CI 0.43 to 0.51, p less than 0.001. Conclusion. This randomized comparative trial in a private practice screening setting only partially confirmed the results of prior studies that, with multiple imaging improvements achieved over 2 instrument generations, an increase in overall adenoma number becomes measurable.